All right. I'm about to come out here. It's like it says 10 seconds on this thing. We'll see what happens. We'll see. And what the heck? Five, four, three, two, one. Let's do this. Hello, everybody. I wish I had some cool introduction music on this live stream, but we don't. Today is May 19th. It's Wednesday. My name is Ka'ala Souza, and I'm working with the Workforce Development Council here in Hawaii to do this thing right here. I've been talking to so many cool people, and they have so many cool ideas, and I want to share that with all of you cool people who are watching on whatever live streaming channel thing that you have, because this has been an upskilling tech thing for me. We have to figure out how to do this kind of things, chew gum, talk, push buttons, and move mics at the same time. So we have had fantastic people on this show over the last couple of weeks here. Senator Kai was on here, Bert Lum, Teresa Sladek from Minnesota talking about digital literacy. And the whole point and what we're trying to do is to let more and more people, to get more and more people to know more and more of what's happening outside of our specific kind of individual sectors or industries or bubbles even, because I am in a bubble. I'm almost literally, I'm in my room right here. I'm in my office. I barely go outside of my zip code. And so trying to keep track of what's going on is very, very challenging. And so what we're trying to do here is bring, like I said, very fascinating people to share some other ideas with you. And today, very, very excited, we have the president of Queens Hospital in this digital house here, Jason Chang, who I spoke with I've been speaking to him for the last, 12 months or so. We've been talking about the future of healthcare and work. And I wanted to get some of his thoughts and ideas about what Queens is doing, specifically here in Hawaii, but also healthcare in general, because there's some stuff going on, AI, automation, and I always ask those kind of questions, and he's probably getting kind of frustrated. But Jason Chang is on our board at the Workforce Development Council, and is a great privilege to have him on here. And so that's enough of me talking. Let me see if I can make this thing happen, push the right button, and I did. Jason, it works. Welcome.
That's great. Thank
Man,
you.
I always
Thanks,
love that whole background that you have going on. I know we talked about that before, but you just look good.
Yeah, thank you so much. It's an honor to be on and just sharing a little bit about what we're doing here at Queens.
Yeah.
You're looking at the background. It's my office, and you have pictures of my family, and it gives me a chance to, remind myself of all the things that are important, as we're spending our days taking care of people and hopefully providing benefit to the community.
Yeah, I like it. And I had to go to that scene, man, where I could see all of your pictures. So it's been a long time. I've been waiting and excited to have you on this live stream. And, how long have you been participating with the Workforce Development Council now? Is it a year, 2 years? What is it? How long have you been working with us?
It's been probably 4 years now that I've been on the Oahu Workforce Development Board. Yeah. Started off actually quite friendly, and Jim Tollefson, if you know that name, invited me to participate. And very soon after I joined the board, he let us know that he was going to be retiring. So I assumed his position as the board chair. I've been there for the past, I believe, 3.5 years now.
Oh my goodness, time is just flying. And I got to ask you these kind of questions because I'm in a talk story mode, right? I tell people all the time, I got questions, but only because I'm curious. But if you have questions, you can always ask me. One of the questions I got to ask always is what high school did you go?
So I get asked that question a lot. And
yes.
I actually grew up here in Hawaii. So I'm from Fresno, California. My high school is San Joaquin Memorial. So it's a little small Catholic high school. I spent most of my life, professional career, and growing up in the Central Valley of California, and then spent some time in Texas before I made it out to Hawaii. But I've been here almost 6 years, and my wife and children love it. And so love Queens, love the community, love the networks that we're in. And so this is home. We're never leaving.
Gotcha. And I know you probably get asked this too, but is Hawaii the best place? Is that a question place I can ask?
My wife and I have talked about this. We grew up in Fresno, California, and the 2 times we get to go back and visit family are in the middle of the winter when it's Christmas and tule fog, freezing cold, and then in the middle of the summer when it's 110 and usually around July. And so, it's a beautiful place, but we don't have to deal with fires and fog and floods and everything else, land or earthquakes and landslides and everything else we're dealing with. And then Texas was wonderful. I mean, great people, but it was down on the border, and you hear a lot of the news about these migrants that are ending up on the border. That was the neck of the woods that we were in. And so, although I did enjoy the people, moving to Hawaii, we've upgraded, and we're not downgrading.
Come on. That's what I want to hear. That's why obviously I have a bias for Hawaii, but I lived in a place really close by Fresno. Have you heard of Vacaville?
Oh yeah. Yeah.
Are you surprised that I know Vacaville?
You're close to Napa, though. That's actually not a bad place to be.
Yeah, I played baseball like when I was a little kid. I was there for a couple of years, and I was on some Vacaville team. I'm pretty sure I got cut from the football team. Just a lot of bad memories you're bringing back up. And my daughter is in Texas, which is weird. She's visiting right now, but so we've been to Texas once. That's it. I'm still gonna flex on Hawaii though and say that this is the best place to be, or what they say, like, hey, come visit, but our population is already pretty busy. What brought you to Queens? What was the thing that made you come? I know it's awesome, but what made you come here? What made you make that big pivot?
I'll be honest, this is really stars aligning. So I've spent my career mostly in the for-profit world. Had a reputation as kind of a turnaround guy. So they would move me from different hospitals within California. And my last assignment was in Texas. And that's a tough place. I had a 2-year-old daughter when we moved there, signed a 3-year contract, and promised my wife that at the end of that, we would start to really look at a place that was in an affluent community, a place we can plant roots. I didn't want to move my kids around, and started to look. And it was really at the very last stages of this recruitment here for Queens that I got put in touch with Art Ushijima, and he agreed. He had already selected 2 final candidates and invited me to meet him in San Francisco. So I jumped on a plane the next day, flew out, and the rest is history. It worked out, and very shortly after that, we moved to Hawaii.
And stars aligned. Had you been to Hawaii before?
Yeah, so my grandfather is Japanese, so half of me is Korean, half of me is Japanese. They were part of the Executive Order 9066 and put in the internment camps at Poston. And my grandfather then volunteered and was a member of the 442. So lived through all of that history. It's really a glorious history, quite amazing. And we would come back here because his friends were half from, here in Hawaii and half from those on the ranches in California. And he was one of the organizers of the annual retreat. So one year they would go to California, and then one year they'd come out here. I had come out with him so many times as a kid, knew kind of what we were getting into when I said, hey, let's move to Hawaii. So no island fever. In fact, we fit in really well.
Yeah, I agree. And I think that kind of history is important for us to keep in mind. It's like this connection back, like to who we are, who we come from. We talk about sense of place sometimes in Hawaii, and usually architects use that term. Does the building fit? Does it have a sense of place? But I like the idea of a sense of place for people. Like, is this where you're from? Who are you from? And how do you fit here? And so I like it. So you got some connection, man. You got some history.
No, it's a total connection. And it's posthumous that, I think about my grandfather, but I feel like his spirit is more here than anywhere else I've lived. And, I think there's something special about that. And so, when I think about like sense of place, I think about, this feels like it's home, Hawaii, Hawaiian Islands. And then I think about Queens and, the things that are really important to me as I've, built myself up over my career. You start thinking about what's important to you and the founders, the mission, the history, the way that we take care of the population and the things that we value. All of those are just core to, who I believe I am. And so it makes me really happy coming to work every day, whether it was pre-COVID or during COVID. You're making a difference, and you are representing an organization that's got 163 years of taking care of a community.
Yeah. And just the fact that you know how many years that is always so impressive. I feel like that again, that connection back to the history that allows us to move forward really confidently into the future. What did you already know stuff about the history, or did you have to go dig a little bit and become a historian, like when you first moved here?
No, so when I first got in touch with Art, I had known about the Queen's health systems and the Queen's Medical Center from before, primarily because they have relationships with other organizations, and so we were both in the same purchasing organization called the West Coast Network. So it's a coalition of 12 hospitals, all independent, that band together to help get better pricing on surgical and medical products. So whether it's sheets and gowns or sutures or knee replacements, it's a way for small hospitals to leverage their all collective sizes, against some of these big players out there as healthcare costs keep going up and up. And so knew about Queens, knew about some of their history, but when it started to become real, I did some homework and had to learn much, much more about Queen Emma and King Kamehameha IV. And, I think what I learned was quite superficial coming in. It was enough to know that it was meaningful and the organization was someone that believed in its history. But since I've been here, I've learned a tremendous amount more about who the king and the queen were based on their journals and, how they documented, their history. And I wish there was more. It's such a rich history. Yeah. And you think about two founders, two of our elite who were in their 20s, and they watched almost 70% of the Native Hawaiian population die because of a pandemic, and felt like they had to do something. And I think about myself when I was in my 20s. There was a very small chance that I would had the courage to do what they did. Yeah. But I'm so glad that they did, because it set a legacy, and one that we now have responsibility to maintain.
Yeah. I don't know why this happens, but that really gets me all the time. The idea of the lead looking out over the people and watching what's happening in terms of the population health, the kingdom health, and then doing something about it. The kuleana that you have here is huge, and a friend of mine was just talking about it. He was just writing about it. He's in Waimanao. We'll talk about kuleana. When he was in his 20s, he didn't want any. And and now he's saying he's like 30, 40, I think, and realizing that the kuleana is what gives him the sense of purpose. And that ties in perfectly with you, So I really appreciate you having that connection, because it makes a big difference to me and to the people that Queen serves.
Yeah, no, I appreciate it.
Yeah.
Appreciate it.
So, I like being, go ahead.
I was only going to say that there's so many more people that have, helped instill that in me. Here, when I landed, that, said, hey, you need to learn about our king and our queen. Can I tell you this story? And it's through these stories that's so powerful. And even today, I learned so much more, every day, someone telling me a little bit about why we built this building, or why we started this program, or, how this came to be. It all has meaning, and it puts the pieces together.
Is there any story that stands out to you from the king or the queen about the hospital itself that acts as something like a big motivator for you, like, and it connects with your core values that motivates you?
I'll give you two. So one of them is Queen Emma, when the hospital was built, really felt like there was something that she can do. And if you think about the 1859s, 1860s, there was not modern medicine. So we did have some level of vaccinations. They didn't really have a whole lot of surgical treatments. And so people really were brought in and just cared for in the best way they possibly could. Some of it through nourishment, some of it through pain control. But Queen Emma felt like she should come through the hospital every day, and she would sit at the bedside of every patient and hold their hand and just be with them, and believe that was part of the healing process. And so I think back about patient experience. That was the epitome of it. She was the first ambassador for Queens as a patient advocate. And so that really does resonate with me, because she didn't have to do that.
Yeah.
But she felt like it was her place. And the second is tied to our mission. Our mission hasn't really changed over the past 163 years. And The last two sentences are around taking care of Native Hawaiians and all the people of Hawaii. And this really has to go, ties into the racial diversity that King Kamehameha IV, when he was in his teens, traveled through the South, and he was on his way to Philadelphia for meetings. And as he was traveling through the South part of the United States, if you think of the 1850s, it was the period of Civil War. And because of his dark skin, he was treated as an African American. And he writes in his journals that some of the people that treated him as an African American were fools because they didn't know who he was and didn't get to know him. And so when he came back, he said that no one should be treated like that. And so hence the line, we will care for Native Hawaiians and all the people of Hawaii the same way.
Yeah, and you're just giving me chicken skin.
Yeah, it's really special when you learn about the specifics and the history of our mission, and why we care for people the way we do. It was way ahead of their time.
Yeah, that kind of stuff always gets me. And interestingly enough, way ahead of their time is kind of where we are now, where it shouldn't matter what the color of your skin is, and healthcare and how you get treated. And that just blows my mind. It just blows my mind how advanced and far ahead of the time they were. And speaking of that, we talked a little bit about the history and where you come from, where Queens comes from, and that connection. But they fast forward me a little bit here now. We're in a completely different world. The governor is talking about Hawaii 2.0 in his State of the State. And I think that's kind of critical. And it just dawned on me yesterday that you can't have, if there's a world 2.0, which we're living in a completely different world, you can't have a Hawaii 1.0. You can't still be living at that first version or whatever version you are. You're in a different version right now. And I'm curious about where you are at Queens in terms of not your versions, and I can't even keep track of that. But what has this last 12 months done to how you provide healthcare? How you fulfill your mission at Queens?
Yeah, I'll tell you, this has been quite a ride. So pre-COVID, we had already been talking about how we take care of patients better. We were at 95 to 99% capacity with our inpatient beds. Emergency department was built to see like 130, 140 patients a day, but we were seeing 200 every day for the past at least 6 years since I've been here. So very high volumes, and we've been talking about ways that we can expand. Single, double occupancy rooms, so everyone has a room, not everyone, but a lot of the patients have a roommate. And then COVID hit, and all of a sudden we felt like, okay, one, we were going to see COVID more than anyone else in the nation, at least maybe first, because we have so much tourism that comes from the Asian countries. And as we kind of sat and watched, it wasn't happening. We watched California, New York in particular, and Washington really get hit hard. And so we felt like the experience they were living through was, this is a bed capacity issue. So we need to slow all of our elective surgeries down. We need to close our clinics so that our beds don't get overrun. It turns out that was not the case, but it changed everything that we did. We had to focus much, much more on infection prevention. It taught us about the way that we take care. You can't squeeze 200 people through an emergency department that was not built to handle separation, 6 feet of separation, right. Isolation for those that don't feel good. So it made us rethink care from an emergent perspective, from an inpatient perspective, and then a post-acute perspective. And so a lot of the last year, and maybe the first 9 months of the pandemic, was spent with just dealing with COVID, reacting to the things that we're watching around the nation, to medications, to things that we're learning from the CDC, from best practice, and trying to implement it as fast as possible. And the whole goal is you have to take care of your people, make sure that they're safe, make sure that they're mentally, feeling like they're at their best so they can take care of patients. Because now that we're looking at it in hindsight, COVID represented somewhere between 5 to 6% of our patients that actually needed care. So there's another 95% of our volume that needed other care, heart attacks and strokes and surgeries and transplants and things that if they didn't get, they weren't going to do well and the outcomes wouldn't have been good. But you still have to treat everyone as if, hey, they may be a potential carrier of COVID. So then the last, say, 5-6 months have been, okay, we need to get over ourselves here and now learn to live with COVID. So that's sort of the genesis of the 2.0 is, okay, so if this is the new normal, what do we need to do differently in order to get ourselves to some sense of normalcy? And if nothing else, make sure that at least we're sustainable financially into the future. So that's where we stand today. I think that the first thing is vaccinations. We need to get as many people vaccinated as quickly as possible. What we are seeing is that the vaccination, if you're on Pfizer or Moderna, is 95% effective. We still have a handful of people that have been vaccinated, fully vaccinated, and have caught COVID. But what we also see is that there's 100% chance that if you have been vaccinated, you're not going to be hospitalized. So if it's the matter of those most vulnerable, the most frail, not being put in a position where they could die or be, damaged or harmed for life and their quality of life changes, then, we fully support that.
That's
on
a
the
big
other
deal.
side, it's a lot of,
it's a big deal.
How do we work with community? How do we work with the Department of Health and our local economy to bring things back and do it in as safe a way as possible, but still promote the economic recovery?
That's a tough one. One thing that got me on this vaccine, I'm in my bubble. I barely go outside of out of my zip code, But we've been doing these computer classes for kupuna in Waimanalo with Department of Hawaiian Homelands. And it was a couple months ago, I think, and a month and a half ago, and Niniao, who was coordinating it, said, "Did you get your vaccine yet?" And I go, "Oh, no, but I missed, I was on a schedule, Texas, the whole storm, so missed the whole thing." She goes, "You're going to feel really bad if you come inside here and you're not vaccinated and one of these kupuna gets something from you." And that really is the big motivation for me, So, people getting hospitalized because of whatever issues, going on. But I just saw was it yesterday or something, we're at maybe 46% of our state is vaccinated or fully vaccinated. That's about right? Is there any reasons why we're not at 100, or what are some of the major... I'm just curious. I know this is not even what we're talking about. I'm just curious what you think.
No, so you've had a whole group of early adopters. The kupuna really felt like life and death. If I don't get vaccinated, I could die, and have been isolated, hunkered down in their bubbles, not even leaving their houses, many of them, knowing that this is high risk for us. That population went through extremely fast. Only took about 2 months before we were able to get almost all of the kupuna. And now we're in that middle range. So it's those that are a little healthier, a little younger. They feel like, hey, we can do this next time. They were put on the schedule, and for some reason they didn't show up for their scheduled vaccination time. So we've done some things like, hey, just walk in. You can get vaccinated anytime, no appointment needed. But we have to put some sense of urgency. And then there's also populations that are more rural and they can't get to the mass vaccine center. So we purchased a couple vans and we're loading up and we're going out. And some days they come back and they say, hey, we were able to get 115 people a day. And some days they go out and they're able to get 600. But we feel it's still, we're at that point that maybe people can't come to us, so we have to go out to them, and it'll be more grassroots and a slower effort. But we're coordinating with churches and civic groups and any small populations of people that are interested, nursing homes, because at this point, there's no pride in saying, hey, we want you to come, to us. Just get vaccinated is kind of the position we have.
Yeah, I get it. Thanks for going down that path for me. I know everybody wants to ask you about that kind of thing, and I'm just kind of curious myself now. But we talked about the history of the hospital itself, Queens, and which is kind of a history of health in Hawaii when you think about it, kind of back up a little bit and look at it from that perspective, and a little bit of the history from 2020 and what COVID-19 has really forced on the delivery, or the changes that has been forced on the delivery of healthcare. You talk about your ER. I've been in that Queens ER before. It's definitely not the place where you want to have a lot of people, and you can't with a 6-foot separation. So you have to think differently about that too. But even before COVID-19, before March or April, May 2020, you and I talked about this before. Like we talked about like the workforce or how the organization, the operation of hospitals and healthcare. And specifically, I want to talk about the workforce itself, because there's some things going on that I was kind of freaking out on. I don't know if you remember, but I was freaking out on, on AI and automation and what's going to happen when the computer can read these pictures and images and get shades of gray that nobody else can see, and access all these things. I'm like, we're going to have a whole bunch of robots doing healthcare. And I think you talked me off the ledge,
Yeah.
But there are some things going on, before a pandemic that was already going to be changing how healthcare is delivered. Can you touch on just some of that? Some of those changes that you were watching before this happened, and maybe a little bit about where we're going to be going?
Those are, great questions. And it's kind of a topic that we're really interested in because AI has advanced. And so whether you call it machine learning, automation, artificial intelligence, they're all kind of in the same bucket. So it's a matter of algorithms that are coming up with ways that they can interpret data or sets of data and come up with patterns. And so for those that believe that AI is going to come in and replace my job, in healthcare, I don't think you have anything to worry about. That there's a blend between needing to have somebody that's actually making a human determination, a human decision that can be backed up by intelligence. And it helps to create standards around the decisions that are made. So if you think about healthcare as if you're a nurse or you're some type of a clinician or a physician, your expertise, because medicine, everyone's a little different. Healthcare is very personalized. So you want somebody that understands your unique situation, your unique situation or circumstance. And then on top of that, then they provide their interpretation on what they think the diagnosis is and what the treatment plan should be. But then if you use intelligence on top of that to take a look at patterns, it may pick little things up and say, oh, but many of the cases had these same patterns, but you didn't think about this. Is that something you should think about? And it gives an opportunity for the physician not to miss something.
Mm-hmm.
If it's interpreting things like x-rays or CT scans, then you need to have that human eye interpret, because every lung looks different. Every bone is a little bit different. So the nuances are not something that a machine can learn. But if there are patterns that it can detect, then you want that expertise. And as we talk about medicine is evolving itself, just as an industry. So it was very much sort of cookbook. So
yep.
You a lot of just, you titrate, there's a lot of science and art to it. And now it's becoming more standard. So you want to have, if you have diabetes, you want to have the same tests and the same type of treatment because you know that the outcomes are most likely going to be perfect if you follow that sort of algorithm. And so the standardization of medicine is kind of evolving itself into healthcare, but it's still going to be specific to the individual patient. So, we want to take the benefit of technology that many other industries have already adopted, and healthcare has been just super slow to adopt, and bring it into the things that we do best.
Yeah. And I appreciate you again talking me down a little bit off of that ledge, because I get a little, oh no, well, or maybe, oh yeah, because if we can actually leverage that kind of machine learning like you talked about, why would we not? Except for I've watched so many Terminator movies. Arnold Schwarzenegger has scarred my thinking of AI, and I don't want people taking control. But you're saying that there's not going to be a lot of people losing their jobs as AI or automation increases in the world of healthcare. That's what you're helping me to understand.
Yeah. And even for those that are non-clinical, so there's, a lot of jobs that people are just making phone calls. If you think about insurance verification, somebody's picking up the phone and making probably 200 phone calls and sitting on hold and pushing the right prompts in order to get authorization for something. It's low yield. Most people don't like it. And sometimes mistakes can be made because it's so repetitive, that if you can improve the quality of the employee's day using automation, why would you not?
Yes.
allows us
Yes.
to get more out of the people and provide a better work experience.
Yes.
And I think that's the name of the game with
Can you
technology.
imagine like somebody saying, "No, I want to call 200,000 phone calls every single day, sitting down in the same place and leaving the same message." I I just feel like that would just like destroy your mind, destroy your life. Talking about quality of life, and like one of the things that you talk about in the beginning was this connection that you have with Queens because of Queens, the mission and their values and your own core values. And I love to see people in places like that, where they can have their values connected to an organization's values and their mission related to that same mission. So that makes sense if AI can free me up a little bit to do things that are more mission related.
Yeah, no, and I hear it all the time when I walk through. I talk to people, and you ask why they are here at Queens. It's because of the mission that they have a connection, a personal connection in some way to their founders or the things that we stand for, the mission statement itself. So, there's ways that it doesn't have to be so mundane. We talk about provider burnout all the time. And how do you alleviate some of that? Let's take away some of the things that they don't want to do and allow them to do the things they really love to do.
You're painting a nice picture of this. My wife has been a nurse for, I don't know, 30 years. We met when she was in nursing school. She had a 4.0 average when we met. And within about a month, I brought that down to a 3.6. By the time we got married, I think she's like a 3.4. I don't know what it is, but she never forgave me for that. But so she's been a nurse, ICU nurse, ER nurse. And so I kind of track a little bit on this healthcare. And the picture that you're painting, what I'm going to call a vision, is actually really encouraging, for me, from my layman's perspective, that idea of helping increase the quality, taking care of your people at Queens, and
Yeah.
and then so that they could take care of other people. That's kind of it,
Yeah.
right?
Yeah, it's exactly it. We're actually going through this survey. We do it every year. It's called the Employee Voice Survey. And what we measure is the employee's emotional attachment to their employer. So in the past, you would ask, do you like your boss? Do you feel like you have opportunities for advancement? 37 questions, kind of a mundane type of a survey. And we switched to this 12 question survey and really wanted to know, do you have a best friend at work? Do you feel like the organization supports you? Simplify it and really get to the core of your emotional attachment to your employer.
Yeah.
Because when we talk about turnover, it's already a high stress environment. We know that, especially, for your wife who's in the emergency department, seeing 200 patients that come through in a trauma center is tough. We ask our employees to get emotionally attached to the patients because it creates a better patient experience and it creates better engagement for the employee. But not every outcome is going to be perfect.
Yeah.
There's some really sad, stories that you live with, and sometimes you have more than one in a day. And so there's got to be a way that, you feel, one, supported emotionally with your employer, and two, that emotional attachment is why you're there, that you're there for a purpose, and not there just because you have to be, because the day in and the day out, it can really weigh on your mind.
Yeah. Yeah. And my wife was in like ICU for years, and ICU, the way I understand, a little bit different. ER people come and you go and you transfer them to other floors. But when you get to ICU, you may have somebody there for days, for weeks, and there's been a lot of this kind of emotional connections that you're talking. And my wife is, I think, the best ICU nurse. Period. Like, you would definitely want her to be your ICU nurse. But it takes a toll, like she would come home just exhausted physically, exhausted emotionally. And I know that there's been times in her career where there hasn't been that support that you're talking about from administration, or, that team wasn't quite there. And it is a challenge, so I'm liking what I'm hearing from you. Makes me want to work at Queens.
Yeah.
I like it a lot.
Yeah, no, I think it transcends, so if leadership doesn't believe in it and creating that environment, then it's not going to happen. And so you have to be very purposeful about creating the environment that you believe you want your employees to work in. And
right.
they talk about Ohana, at Queens all the time. And I do. I feel like we have one big family of people that care for the community.
That's a tough one. The idea of ohana in a workplace. It's like I had somebody ask on the Big Island one time, like, "Hey, how do you fire ohana?" But you can, I guess. If you're not doing what the expectations are of the family, that doesn't mean that you're not family. It just means that you're not going to be working here. This is not the place for you, and then that's okay. I'm reading all these future workbooks, and one of them was saying that sometimes we think erroneously that work is economic first and social second, and they're suggesting that it really is the opposite way around. And it may not be right now if you're watching this and you're thinking like, I can't pay my bills because I need economics first. Once you take care of that basic kind of Maslow thing, the social part they're suggesting is first, this connection that you have to the people, to the mission, and then there's an economic benefit to it. And that changes how we look at work going into the future. What do you think people should do to prepare for, these, like a career or a job in healthcare? How do you guys set it up for people? If I want to be in healthcare, like I want to be in whether it's Queens or whatever it is, but how should I think about it? If I'm a new grad or if I'm in high school, something like that?
Yeah. So honestly, I think that's a great topic to talk about, because you have some people that have already self-selected. I love taking care of people. You're in it for the right reasons. I want to be a nurse. I want to be a physician. I want to work at the bedside in some capacity that helps people. And you already know what path you want to go down. Then there's others that you need to discover, and that's our responsibility to reach out and provide just some education about what opportunities are within the hospital walls. So we've been working with some of the local high schools and the health academies, just sharing that you don't always have to be, right at the bedside. You don't have to be a nurse or a doctor. There's other jobs inside the hospital walls that make meaningful difference. And within the hospital, there are people in finance and grounds and facilities that help make the machine continue to move forward. And so everyone's vital. Everyone has an important place. But it's just a matter of figuring out how you fit in and what you're passionate about. And the sooner you start to ask those questions and try to, look at yourself introspectively and figure out what makes you tick, the sooner and faster we can start, helping you go down that road. And, it may be your counselors if you're in high school, counselors if you're in college, but there's also ways that people can get internships, spend a summer just volunteering at a hospital or a healthcare entity and learning about the things that they do. Sometimes you may think that you want to be a nurse or a physician, and then you jump into it and you're like, ooh, this is not what I signed up for.
That's right. Which is real. That's very, very real. The challenge is real. The challenge is real. I like that idea of checking in with who you are, what your passion is, for people who may not know already. Like my wife was like, I'm going to be a nurse. When she was 17, her mom was a nurse. Her other sister was a nurse. Other sister was in hospital administration. And right now she's a nurse practitioner. So, she's been down that path for a while. But for other people who may not have been clear early on for their passion, I like this question of finding out, who you are, of checking it out, of trying it out and see if that resonates with you. Do you have people who come and they go, yeah, I didn't know it, but this is for me. And other ones, they go, hey, thank you very much, but no thanks.
Yeah. No, exactly. I'll tell you, I grew up actually in Fresno on a farm, and my grandfather had a packing house and some property. And I spent really my entire youth working out there in those fields and in the packing house. And I learned very quickly that there was not a job on that field or in that packing house that I was passionate about. And so somewhere I needed to go actually get an education and find a different path.
All right. I like it. I don't want to do this, so I'm going to go do this. I like that too. I feel like my path has been like so meandering all the way around and do this and do that. And if you ask me now what I want to be when I grew up, I'm still going to be like, well, I'm checking some things out, But for the most part, it has been some consistent core outcomes that I'm looking for, like things that I want to provide or do for others, So That's an interesting path. What about people who, maybe they're in college or out of college, or is there a way for people who are in a 20s, 30s to pivot into healthcare? I don't know.
Absolutely. Absolutely. And even physicians, we have a few of our physicians that were engineers, had a career, were going down it and decided midstream that they were going to change and go into medicine, and they became passionate about it. And that's quite an investment because they'd already started a career. But if you're in your 20s and your 30s and all of a sudden you realize you have a passion for something, there's paths to get you there. And we can help. We have lots of people that have been able to provide mentorship to those trying to figure out, what's the best path. And again, it's that pursuit of a career that's meaningful and rewarding. And is there a path to get into that in that lane?
I gotta ask, because my follow-up on that is like, when you say we can help, I love that. I love that. Who do I call? How do I get to this pivot help people?
Yeah. I think the first one is you can call our human resources. That's kind of the easiest, top of my mind. But also we have people that are in our volunteers that are happy to, you could reach out to me. You could reach out to any of the organizations in the community. I think if you think it's nursing that you want to get into, reach out to the universities and the vocational schools. You can learn so what's the path look like? Some of that's, half the battle. Somebody that's coming out of high school feels like, oh, I got to take this test. I don't know if I'm going to do well on, the ACT or SAT or whatever the entrance exam is going to be. And so that's the first level of discouragement. And then the second is they say, oh, but you have 8 years of school ahead of you. And then that becomes the second, level of discouragement. For somebody that may be young and, a little apprehensive. But as you gather some experience under your belt and some confidence in the direction you want to go, that maybe it's time to reapproach it. And so what I encourage people to do is never, if you feel like there's a more passionate career path for you, explore it.
Yeah. I like, again, the economic benefit almost secondary to a place where you can have your values, your mission be aligned with, with where we spend most of our day.
Yeah.
That makes a lot of sense.
About 10 years ago, we were looking at, I know I was in Texas at the time, but we were looking at the turnover rates of our nurses. And it seemed like we had this really good core of nurses who had been there for 20, 30 years. And then all of a sudden they were starting to retire out, and the new nurses were coming in. And within the first year, they were leaving my hospital for another hospital, or had left another hospital and were coming to my hospital. And after maybe about 6 or 7 months of this, I asked for just a focal group, and we sat down and talked, and it just seemed like the mindset was a little different, and that we had to create other things that were appealing to the nurse. And so it made us have to reinvent the way that we engage with our nurses and our employees at the time, the hours, the shifts, things like that. And some of them just were trying to figure out, they knew that they loved nursing, but they didn't know what specialty in nursing. That emergency department was where they got their first job because that's where the opening was, but it may have been too intense and they wanted to be a labor and delivery nurse. So
yes, which is kind of intense, but kind of cute too, right?
Yeah. But helping people find the calling, within maybe that same industry.
I like you using the word calling on this idea of where you are supposed to be, where you belong. And again, your sense of place, I think, in your job. This is an interesting thing for me because as I go further and further into more like remote thinking, I call it like remote, thought processes from people talking about the future of work. We're actually looking sometimes at a future where maybe work doesn't even exist the way that we think about it now. And it's more that, like you said earlier, the machines or robots are doing things that we're not going to do. And we're going to focus on things that are more related to what our maybe passion or concern is. And I forgot, I've been so in our conversation that, there's people who are watching this live, and this is live. So make sure you ask questions. I can only see them on YouTube. So if you're on YouTube, just jump on and say hi or something. And if you have any questions before we go, but I want to go to a conversation that we had, speaking of things that were freaking me out, that you've talked me off the ledge, in terms of automation and AI, which I think is huge. The pandemic has changed our world and probably never going to go back to the way it was before. But AI and automation, all that kind of stuff that we were talking about, was already making that change happen. Self-driving cars, the trucking industry, what Andrew Yang was talking about in his platform bid for president. Those kind of things are already going on. One of the things that we talked about, and I can't remember fully, and I couldn't find my notes, was this thing, like big companies like Google, I think, wanting to come into Hawaii and, I don't know, provide, what was it, training, tools, resources. Can you remind me about that and share a little bit about that?
Yeah, no, happy to. So we are having a conversation with Google, and it's their healthcare. So they have about 150 different arms underneath the parent corporation. And Google Health said, hey, we're interested because it's a unique population and we don't have a presence. And they said, basically, help us come up with a solution for a problem in Hawaii. And one of them was, we have populations that are in rural areas and so don't have access to doctors, the specialists, whatever it is. Maybe they don't have access to the right food. And what Google basically said was, look, we don't want to be a Me Too. So don't say the solution is to create another EMR or something like that that's already exists. We want to create something that the world has never seen, that the world may not even know it needs. And so think way outside of the box. And so it gave us an opportunity to sit down and think, okay, so how do we create something that's good for the population and meaningful at the same time? And so we were kind of going down the road of, this is just one of the brainstorms that we had, was that if there's technology out there that Google's already good at, why could it not help to diagnose a patient? So say it's in the emergency department, the ER physician has a few minutes to make an interpretation on, whether the patient is okay, or if they need to have these type of tests or those type of tests or this type of scan. And if you could find a way to capture more information about the way a person lives and the places they go, and if you can even monitor things like their gait, so the way that they walk or their presentation as they get out of their car, could that help provide more information to the physician so that they can come up with a more comprehensive picture of what's going on with the patient and do it really fast? Then that could revolutionize the way healthcare takes care of people. And so we were trying to find populations and ones that were a little more isolated, so you can look at a community and then have more information about the health and wellness of that community. And then as they render care, whether it's emergent or urgent, then again, we can be better and faster at the diagnoses. So I think there's a lot of technology out there that doesn't exist, but is on the cusp of somebody creating a really good idea.
Yeah, and I'm so glad that I'm just lumping all of us in Hawaii with you at Queens, that we are in that kind of conversation. Sometimes I think we feel, again, people in Hawaii like myself, that we're so far away, that we're an afterthought, that we're not, in this arena. And we're not just in the arena. I think we're actually, on the field here. And I really appreciate that you're a part of that and making that kind of things happen.
Yeah, no, happy to do that. Anything that we can do to bring, these large companies to Hawaii and show them what we have. I think we have more to offer than they know. And it's a matter of getting the word out and showing them what the opportunities could be.
Yeah, another big challenge. But the idea of having Google, like you said, thinking about, hey, show us a problem and we want to help you solve it. And we're going to bring all of these resources to bear on that. I remember now you were talking about they had solved some problems in Africa or some part of Africa where maybe they did some water things and some food things. and brought all their resources to that one area. I would love to see that kind of stuff happening here in our state.
Yeah, me too. And that's why we continue to have the conversations. Yeah. It's exciting. Really.
Oh my goodness, yes. So you've talked me down off the ledge off of the AI automation thing. So now I can be more excited and eager about that happening. People are not going to be losing jobs left and right, which is kind of the picture sometimes, right? The doom and gloom picture. You used to cut ice out of a frozen lake, and then you lost your job because of electricity and refrigerators. That's a true story. I mean, they used to. But now what's happening is I think we can leverage it. Like you said, we can use it. I can relax a little bit on my Terminator, Arnold Schwarzenegger inspired, nightmare things, and look forward to some of these changes that are going on.
Yeah. No, totally agree.
Wait, you're not agree. I feel like you're analyzing my psychosis or my Terminator issues going on right now, surfacing. But I want to thank you so much for being a part of this and for sharing your time, your ideas, your mana'o, and really your connection. That your connection to the hospital, your role in the hospital at Queens, the connection back to our ali'i, the king and the queen, your core values, your grandfather, that kind of stuff makes me feel, I think, more solid, more secure that you're at that helm there and helping to steer, and we're in good hands with you. Really appreciate that.
No, thank you. It's been an honor to share my story, and really appreciate the invitation.
All right. Well, let me close this out. Just mind expanding kind of things going on. We can get Google coming in, solving some of our healthcare problems. We got a whole bunch of perspective on things over here in healthcare in different ways. And so thank you again, Jason, for sharing what you had to share. And thank you for those of you who have joined us here live. If you're watching this after or pieces of this, don't hesitate to write any questions. I think one of the things we're trying to get to here is that this is a live thing, so you can drop in questions, and I'm trying to track them. But put them on there. Like and subscribe if you're on our YouTube's channel, because it helps us to get the word out to others. We have a whole bunch of people coming up scheduled over the next 3 or 4 weeks. Coursera, speaking of online learning, is going to be on next week, Wednesday, same time, and talking about some of the resources that they have that are available for people who are interested in upskilling. We had somebody on from LinkedIn Learning, 6 weeks ago, 8 weeks ago. And so Coursera was like, hey, we want to come on too. So that's happening. Thank you all very much for joining. Malamapono, Ohuiho, and take care.